Ever wondered what the bony protuberance on the lower part of your rear was while sitting down? That's known as the ischium, the bone that carries all the weight in the upper extremities when sitting down. The ischium is connected to two other bones, the ilium and the pubis. All three bones join together to form the pelvis, also known as the os coxae or the hips. The pelvis is in the lower part of the trunk and is important for childbirth, since the birthing canal is connected to the uterus and the vagina and is in the same location. The ischium also helps support the spine as well as aiding the leg for support through the retraction of the limb, extension of the hip, as well as outward rotation. The ischium is in the inferior dorsal part of the hip bones. The ischium is a U-shaped bone and can be seen on both sides of the pelvis. There are two ischia. Both contain the following structures. The inferior ischial ramus connects to the inferior pubic ramus. These bones also enclose part of the obturator foramen, a hole in which the blood vessels and nerves pass through. The ischial tuberosities are formed by the connection between the posterior and inferior of the ischium. The tuberosities are important since they hold the body weight. The posterior side of the ischium has a greater sciatic notch, an indentation where the ischium and the ilium join together. Below the sciatic notch is the ischial spine. It's located at the inferior edge and is used to attach important muscles, including the coccygeus ligament and the sacrospinous ligament. The body of the ischium has an important spine, as well as the adductor magnus, one of the largest muscles surrounding the ischium, which helps with the rotation of the hips. The anterior side of the ischium is the ischial tuberosity, which can be felt while sitting on a solid surface. The inferior ramus of the ischium is where the two muscles, the gracilis and adductor magnus, insert. The function of the ischium is to unite the ilium and the pubis to form the hip bone. The vertical inner wall makes up the lateral boundary of the true pelvis. The true pelvis is the cavity in the lower trunk, which is seen laterally and anteriorly by the two hip bones, also known as the location of the following organs: pelvic colon, rectum, bladder, and some of the reproductive organs. The rotator muscles of the femur inserts on the ischium, while the ball of the femur inserts to the acetabulum. The ischium is also responsible for providing protection to some of the organs of the urinary system and reproductive system, including the bladder, lower colon, lymph nodes, uterus, and vagina. An interesting fact about the ischium is that it's fused with the other bones of the os coxae at birth, but later on fuses together with the ilium and pubis during development. Some of the important ligaments that attach to the ischium include the sacrospinous ligament, which goes from the ischial spine to the sacrum. The muscles of the lower limb, including the neurovascular, is alongside the sciatic nerve and the piriformis muscle. When people tend to have pain in their bodies that's related to the ischium, the pain is seen in the hamstrings, back of the thighs, or on their rear. Ischial tuberosity pain can be clinically diagnosed as Weaver's bottom and is often seen in many athletes, including cyclists, soccer players, and runners, and tends to worsen over time. The ligaments surrounding the ischial tuberosity, as well as the stretching of the hamstrings, may cause pain through inflammation of the bursa and separation of the gluteus maximus. There are very rare cases where the ischium can become fractured. These types of fractures are known as avulsion fractures, in which the portion of the bone is pulled away from the main bone due to the pulling and tearing of the surrounding tendons and ligaments. It is commonly seen in young athletes. Some of the ways athletes get injured are through overusage of the muscles and incorrect posture while working out. Some of the other conditions that can affect the ischium includes Paget's disease of the bone, arthritis, trauma, osteomyelitis, cancer, and inflammation. Paget's disease is a chronic bone disorder that is found in the skeletal muscle in adults that affects the normal bone. The bone then becomes not synchronized due to the inaccurate bone growth development, which creates abnormal and dense bones. In conclusion, this complex bone is not only a foundation for daily tasks such as walking, sitting, and physical activity, but helps protect important organs. Without proper development of the ischium, it would not only affect an individual in their growth and development, but harm the surrounding bones, organs, and bodily systems. The ischium will always be an important anatomical landmark and a major bone in the skeletal system.